Hi there, I'm Nora Stern. I'm a pain educator and physical therapist. I've been helping folks with chronic or persistent pain for about 25 years, and I'm glad to welcome you to this module on rethinking pain. We'll look at why pain can linger and why it's been misunderstood for so many years. And we have some good news about some of the things that you can think about to change your pain and decide where to start. So first, let's talk about your pain experience. For example, have you ever had pain that lasted way beyond normal healing? Or pain that spread, moved around, feels like it got bigger? Does your pain sometimes increase with stress? When you're on vacation or having a really good time, do you find that your pain doesn't bother you as much? That's very common. Also, has pain often kept you from getting a good night's sleep? You may have had many tests that were done, but nothing seems to explain the pain that you have. Medication might help some, but doesn't completely take your pain away. You may have tried injections or surgery, but your pain returns and gets worse. And you may even have gotten the sense that people don't think your pain is real. These are very common experiences for people who struggle with chronic or persistent pain. And we now know a lot more about pain than we have in the past. For over 400 years, we misunderstood pain, and now we have a better understanding about the various causes of pain and some of the new approaches to help you deal with pain. So let me first say, your pain is very real. Let's talk about why we have pain. Pain is designed to protect us, to warn us that we need to pay attention to something that might be harming us. And we know that pain is not only the result of something that happens in the body. Pain is actually produced in the brain, which helps to explain some of pain's complexity. And it also helps us understand how pain can change. Many things can make pain worse or better. So let's look at some of the things that affect pain. So as an example, let's look at what happens when you have an injury, say to your knee. A message gets sent up to the brain that something's happened to your knee that might need your attention. But it's not actually pain yet. The brain has to take that information and make sense out of it. So actually the brain has a big role in how much pain you experience. In addition to bodily injury, many things can influence how much pain you experience. So for example, pain and stress work together to help us respond to emergencies. Often stress is involved with pain even when it's not an emergency. Concerns, worries, and attention are also a part. Concern about an injury, about what might happen in the future, or about other things that are going on. And the focus of our attention can change pain. If we're focused on pain, we tend to feel pain more intensely. And when we're involved in something else, especially something that makes us feel good, we tend to feel pain less. How we move, how active we are, that is a big part of pain as well. If we're protecting a part of our body that hurts, bracing and guarding it, we tend to move that part less, and this creates really significant changes in the brain so that it can begin to feel like the pain has spread, moved to a new area, or can feel hard to locate. How well we understand pain can have a big impact on the pain that we feel. Pain can be very confusing, and it can be worrying and stressful to try to find solutions. This actually increases pain. If your pain has lasted for a long time, it's actually likely that more parts of your brain, more brain functions have become involved, even like memory and expectations. For example, you might remember your pain in connection with things that you've done in the past, like having pain every time you bend over at work for the past year. So this can affect your expectations. When you bend over, you expect it to hurt. And your brain begins to produce the pain response even before you bend over. We actually say nerves that fire together, wire together. The brain becomes better over time at creating pain. It actually learns pain. But the good news is that the brain can also unlearn pain, because the brain can change. The more we understand pain, the more hopeful we become about our ability to change things. We can quiet our stress. We're also quieting the emergency response system in the brain, which can decrease pain. Then we have less fear of re-injury, and we start to feel like we can get back into action. We start to do more things that we enjoy. And those parts of the brain that have been busy producing pain get busy doing other things. This is a process of changing habits, activities, feelings, and thoughts that actually changes pain itself by rewiring the brain and quieting pain. And you can do it all yourself. So, let's answer some questions together. Based on what we just talked about, do you think if you have a bad X-ray, does that mean that you will definitively have bad pain? It turns out that those things are not necessarily connected. People can have pretty awful X-rays with not a lot of pain, and can have pretty good X-rays and have terrible pain. The picture doesn't tell the whole story. What about medication? Is medication the only thing that can help you with your pain? We now know that many things can change pain, and while medication can be helpful, it's only one part of a good pain care plan. This module can help you slowly make changes to get back to the things that are important in your life and start you on the journey of quieting and unlearning pain. It helps to start with the things that are most important to you. So let's consider for a moment what your own priorities might be, so it's easier to decide where to start. Poor sleep. Do you notice that your pain gets worse when your sleep is worse? Poor sleep is a big contributor to pain for a lot of people, and poor sleep means that we don't get time for our bodies to reset from the day, and that stress on the body can build up and increase your pain. So this can be a great place to start. What about pain that changes with stress? Gets better when you're having fun? Pain can often have a lot to do with stress because the stress response and the pain response are both part of the emergency response system inside of us. So it's really common for those things to go together, and we can change it. Have you found that you're doing less and less, avoiding activity because you're afraid of pain? We can help you with gradually getting back into action. What about pain that spreads, moves around, feels like it gets bigger? Pain can change and spread when you move less and less. This is one of the things that you can improve a great deal as you slowly get back to activity. Are you wondering if your eating habits might not be as great as they could be? Foods that have low nutritional value affect pain kind of like pouring gasoline on a fire. And healthier foods are like water on the fire. So that's what we want to help you with. All the things that you can do to change your pain, like your sleep, your mood, thoughts and feelings, how much you're moving, the food that you eat, and how you think about pain and how it works. Because these are things that you can change. We learned a bit more about how pain works and some of the key things that are most effective in changing your pain. You'll have an opportunity to learn a lot more about these topics as we continue this journey together. But you'll be doing more and more. And remember, this is a process, so please be patient with yourself. You're taking a very important step to getting back to the life that you want.